Wow.
Good afternoon or good morning, depending on where you are. My name is Miriam Aliso from the Center for Parent and Information and Resources, and I am here to welcome you to the webinar, Update on Federal Mental Health Efforts. And we have a few features that you can use on your screen. We have closed caption available to you. And to start using closed caption, just click the caption button where it says CC. And also, we have interpretation to Spanish. Y para acceder al canal en español, van a ver en la banda o cinta negra inferior un globo que indica interpretación, interpretation. Haga clic allí y luego seleccionan español y oprimen donde dice Mute Original Audio. Esto último filtra completamente la señal en inglés para que puedan escuchar con claridad a nuestro intérprete Guillermo. I'm going back to our presentation.
Great. Thank you, Miriam. I think all of you know me. I'm Carmen Sanchez, and I am the program lead for the Parent Center program here at the United States Department of Education. Before I introduce Katie, who will have some information for you about these mental health efforts and how you can be involved as a Parent Center, I just want to remind everyone that those of you who are CPRC or PTI, that your request for your supplements, if possible, if you can get them in by this Friday to your project officer, so we can go ahead and start processing them later on in the summer. So please be cognizant of the fact that we have a deadline coming up this Friday. And with that, I'm going to turn it over to our Deputy Assistant Secretary for the Office of Special Education and Rehabilitative Services, Katie Neese, who will be speaking to you on this topic of mental health efforts. So thank you, Katie.
Yeah, Carmen, thank you. And Miriam, thank you so much. I really appreciate you guys giving me some time on your agenda today. I wanted to just bring to your attention two things that were announced last Thursday related to school-based services and the Medicaid program. The first is under the Bipartisan Safer Communities Act that the president signed in the aftermath of Uvalde, which I can't believe has been a whole year today. So my prayers to those families, very heartfelt prayers to them. The legislation tasked the Department of Health and Human Services, and specifically the Center for Medicare and Medicaid Services, to revise a claiming guide on the Medicaid program for school-based services. And the legislation said that that HHS needed to collaborate with the Department of Education. So for the last 10 months or so, we've been working to update that document, and it was released last Thursday. And the purpose of this is really to inform school personnel, school leaders, school administrators, and state Medicaid agencies on strategies they can pursue to develop state policies that will make it easier for schools to build a Medicaid program for health, behavioral health, mental health services. Many of you know that Medicaid has an early periodic screening, diagnosis, and treatment program, lovingly referred to as EPSDT. And EPSDT is really, in my mind, the gold standard of insurance benefits for children, and especially children with disabilities. Last August, the Department of Health and Human Services put out an information bulletin to the state Medicaid directors, reminding them that mental health services are part of EPSDT. And so the task that we were charged with was to update this guide. So the guide was released last Thursday. It will also be followed by a technical assistance center that should be awarded sometime next month. And it's one resource that we hope can help schools better deliver services, not only to children with disabilities, but all children enrolled in the Medicaid program, which translates to about half of all kids in in public schools. And we think it's about 60% of students with disabilities who are eligible for Medicaid services. The reason I make that distinction is we know that either because of family income or by disability status, that many children with disabilities are eligible for Medicaid. We also know that many families who have their child enrolled in Medicaid may also have some sort of private insurance. And as you know, when it comes to special education services to kids who have IEPs, those services are at no cost to families. And so this reinforces that, that safeguard for families. As part of our work, and I have to be careful here, so the Department of Education, so we've got the guide. So I would encourage you, and I think I sent the link to Carmen and she can get the guide out for you. If you have any questions, happy to set up a separate time to walk through what it is. The parents are not the primary audience of this guide, but we wanted it to be usable by parents so that they could understand the why. And the why for me is, and we've heard from you guys for the last almost 2 years since I've been here about personnel shortages, about if I hear from one more family who's been challenged for their kid to get speech, I mean, that is sort of like the one thing I hear over and over and over again. I am really hoping that if schools can do a better job of accessing Medicaid reimbursement, that they're going to be able to hire the staff that they need, whether it's a school nurse or a speech therapist, and those things. And so it really can contribute to the financing of appropriate services for all kids, but especially for our kids.
Katie, were you meaning to share your PowerPoint at this point?
Yes, I'm going to do that now.
Okay, great. Sorry.
Yeah, no, I appreciate it. So before I share my PowerPoint, I have to give a disclaimer. So the Department of Education issued a notice of proposed rulemaking last week, and it is out for comment. So I can't take your comments, but I can tell you what's in it. And so I would encourage you to take a look at it, and please send in your comments in the way that the NPRM requires. So this is a change. What we are proposing is a change to an IDEA regulation. And I'm going to pull up my my PowerPoint because here we go. Okay, can you guys see that?
No,
Not yet. It's loading your PowerPoint. What we seem to be able to see is your list of materials.
Let's see if I can.
It seems to be sort of stuck in a loading pattern.
Okay. Well, I will talk through it, and if it doesn't load, I will
You might need to stop and reshare.
Let's do that. See if I can close it. Can you see it now?
no.
We can
Not
still
yet.
only see your list.
Fascinating.
I
Okay.
think if you
Share
pull it
them later if you
before you
want.
share.
Yeah. Let me
Don't be
do that
posted.
because it's not super complicated, and I have 3 slides that are visual that I hope will make what I say, which may sound complicated, not be that complicated. So, and I'm going to speak. The first I'm going to speak to is what is the current policy or requirements for written parental consent for IDEA students if a school wants to bill Medicaid for those services. So there are a total of 5 steps. The first step, or the step I'm starting with, is that a child is enrolled in Medicaid. And with this first step, when you enroll a child in Medicaid, that act of enrollment, parents give consent for Medicaid-approved providers to bill that Medicaid. And that's true for all children, not just children who have IEPs, but that's true for all children. The second step for kids with IEPs is parents have to give, as you guys well know, written consent for their child to be evaluated or reevaluated. The third step is that parents have to give written consent for a child to receive special education services. So once an IEP is developed, parents have to sign off that says, yes, these services can be delivered. We agree with this part of the IEP or all of it. The fourth consent that is in current law is that parents have to give written consent for Medicaid-approved providers to bill Medicaid for services in a child's IEP. And then the last step, and this is true for all children, that parents have to give written consent under FERPA for the school or the education system to disclose any personal information like the child's name in order, or whatever information would be needed to submit to the Medicaid agency in order for the billing to happen. So those 5 steps are what is currently required under current law and regulation. What we are proposing in the NPRM is taking out the 4th step. And the 4th step is basically a duplication of the 1st step. And I don't know any parent that wants to do the same thing twice when once would be sufficient. So what we're doing, and when I can share my slides with you, you will see that if you take away the IEP related or the IDEA related consent things for a parent just on the Medicaid billing piece, right now for kids who have IEPs, there are 3 elements. One is the initial, when you, the consent to bill Medicaid as part of Medicaid enrollment. That requires a written parental consent. 2, a consent to bill Medicaid for IEP services. And 3, a consent for FERPA for personally identifiable information to be shared with the Medicaid agency. So what we're going to do is to establish for all kids, when it comes to Medicaid billing, that there's the initial consent upon enrollment and the FERPA consent, and that's it. So we're taking out that extra one that says you have to get parental consent for IEP services because it's our position that those are duplicative of the initial enrollment. The last thing I want to say, and this is probably more important than what's in the proposed rule, is what is not in the proposed rule. And I'm going to read off 6 things that the rule does not change at all. The rule does not change at all the written consent requirement for an evaluation under IDEA. The rule does not change at all the consent required for IEP services. The rule does not change the requirement that IEP services are delivered at no cost to the child's family. The rule does not change at all the requirement that IEP services cannot diminish other Medicaid reimbursable services. The law does not change at all Medicaid's position as the payer of first resort for IEP and IFSP services. And it doesn't change at all the consent obligations under FERPA, which is the Family Educational Records and Privacy Act. And so why do I say all of that? And I know it's a mouthful, is that what we're trying to do is make it so schools can appropriately bill for services that they deliver. And, oh, there they are. Okay. So this is, so you'll see this, what I just talked through. So the blue boxes are what's required for every kid. The green boxes are what's required regarding kids who are receiving services under IDEA. And this box with the arrow is the one we're proposing to eliminate. So if let's see, can I go to the next slide?
No, it's Miriam's slides. So
oh, okay, Miriam. So this is basically, thank you. So the top blue part is what's the current requirements, and there are 3 steps. For kids without IEPs, as I said, they're just those 2 steps. And our proposal is to have the same policy when it comes to Medicaid billing be the same for all kids. So that's really the premise of this. And again, Medicaid, just as a point of reference, and this, to me, at the end of the day, what is motivating us is we want to make it easier for schools to gain more resources to provide the services that kids need, period. And that Medicaid last year provided, schools were reimbursed, Medicaid supported about $5 billion of school-based services last year. If you compare that to the Part B appropriation, which was a little more than 14.1 billion. So it's significant money that if we could make it easier for schools to be able to get reimbursed for these services through a public program, we think that will be good for kids. And at the end of the day, what I really want is every kid to get the services they need when they need them. And school, whether it's for kids with IEPs or kids without IEPs, school is a place where kids are. And we just want to make it easier for those funds to end up in a place where they can really help kids. So I'm sorry I didn't get this to you last week, but I did want to get it to you now. And I can't take any of your questions, but I can leave you with the slides, and I can encourage you to take a look at the rule. And I would love for you guys to take a look and make comments. But I also want to reinforce this doesn't diminish parents' rights in any way. It just means instead of doing the same thing twice, you only have to do it once. And it doesn't change anything when it comes to at no cost to families. And it doesn't change anything when it comes, like, for instance, if you have a child who has cerebral palsy and they get physical therapy as part of their IEP, and then that child has to have surgery related to their cerebral palsy that requires PT as part of their rehab from the surgery, this doesn't diminish their surgical related PT benefit at all. And so I think that was one of the things that we wanted to make crystal clear, was that just because a Medicaid benefit could be tapped for IEP services, that in no way diminishes your Medicaid benefit at all on the health side. And so I think that was something that we wanted to make crystal clear. So Carmen, thank you so much for getting me some time today. And the slides are yours to share. And I just really appreciate the time to be able to let folks know about these 2 announcements from last week.
Thank you so much, Katie. And you'll notice, people notice in the webinar chat, there's the links to both the Federal Register notice and I believe also to the new guidance that's come out about mental health services. So, and of course, we will have this recording. Actually, we will have a recording for people to listen to for those, because we've had about 13 attendees on this, but it will be available for everyone.
Right.
Okay, so
Great.
yes, the comments can be made in writing, and in the Federal Register, that was one of the questions. In the Federal Register notice, it tells you how to submit written comments. So you will find everything you need in the Federal Register notice, the due dates, and also how to make those comments. Because as Katie says, we can't take the comments ourselves. It has to go through the formal process.
Right.
Okay.
So thank you very much. I really appreciate your time, and look forward to continuing to work with you, and just grateful for the work you do every day.
Thank you, everybody. Bye.
Okay, thank you.
Bye.